Hello everyone, welcome back to Nurse Lizzie TV. Today I'll be talking about ulcer, the very common health problem that many people misunderstand. People think ulcer is caused only by stress or skipping meals. Others believe peppery food automatically gives ulcer. But how true is that? An ulcer, also called peptic ulcer, is an open sore that develops on the lining of the stomach or the upper parts of the small intestine. There are two main types: gastric ulcer, which occurs in the stomach, and duodenal ulcer, which occurs in the small intestine. These sores happen when the protective lining of the stomach is damaged, allowing acid to injure the tissue. The two most common causes of ulcer are Helicobacter pylori infection and excessive use of painkillers. H. pylori infection is a bacteria that damages the stomach lining and increases acid production. Excessive use of painkillers, drugs like ibuprofen, diclofenac, aspirin. When used frequently or without food, they can damage the stomach lining. Other contributing factors include smoking, excessive alcohol, severe stress, skipping meals frequently, and family history of ulcer. Common symptoms include burning or gnawing stomach pain, pain that worsens when the stomach is empty, nausea or vomiting, bloating, heartburn, and loss of appetite. Danger signs include vomiting blood, black or bloody stool, severe abdominal pain, sudden weakness or dizziness. These may indicate bleeding ulcer, which is an emergency. Ulcer can be diagnosed using stool test or breath test, blood test, and endoscopy. Ulcer is treatable, especially when detected early. Treatment may include antibiotics to kill H. pylori, acid-reducing drugs, and protective stomach medications. Antacids are fast pain relief. Examples include magnesium trisilicate, aluminum hydroxide, Gaviscon, and Malox. They neutralize stomach acid and give quick relief from pain and heartburn. They do not heal the ulcer, but use for temporary relief and take 1 to 2 hours after meals. H2 receptor blockers reduce acid production. Examples include cimetidine, ranitidine, and famotidine. They reduce the amount of acid the stomach produces, allowing the ulcer to heal. Common side effects include headache and dizziness. Proton pump inhibitors are the most effective ulcer drugs. Examples include omeprazole, antiprazole, esomeprazole, and lansoprazole. They strongly reduce acid production and help ulcers heal faster. Best taken before meals, usually in the morning, and should be taken exactly as prescribed. Ulcers caused by H. pylori require antibiotics. Common combinations include amoxicillin, clarithromycin, and metronidazole. Complete the full course even if symptoms improve, or the ulcer may return. Stomach lining protectors form a protective barrier. Examples include sucralfate and bismuth salicylate. They coat the ulcer and protect it from acid, helping healing. Standard ulcer treatment for H. pylori positive ulcer is called triple therapy, which involves taking a proton pump inhibitor like omeprazole together with 2 antibiotics for 10 to 14 days. Drugs to avoid if you have ulcer: ibuprofen, diclofenac, aspirin, and self-medication with painkillers. Ulcer can be prevented by eating meals regularly, avoiding excessive alcohol, quitting smoking, taking painkillers only when prescribed, managing stress, practicing good hygiene to prevent infection. Pepper does not directly cause ulcer, but it can worsen symptoms. Ulcer is common, but it is preventable and treatable. If you have persistent stomach pain, don't ignore it. See a healthcare professional. If this video helped you, like, share, subscribe, and turn on notifications for the next video. Thank you for watching, and I'll see you in the next video. Bye for now.